So historically, because I do want to get into this and set the tone of even what is hyperbaric oxygen chamber therapy, because so many people have different ideas. Like I started this off, HBOT isn't just HBOT, right? And everyone has a different conception or may not even know. So maybe Dr. Elamir, could you answer just on a general level, what is hyperbaric oxygen therapy?
Sure, absolutely. So hyperbaric oxygen, simply put, is breathing oxygen in a pressurized environment. Typically in terms of medical grade hyperbarics, it can be administered in what we call a monochamber. And that's the most common type, where an occupant is laying down typically horizontally in a fiberglass tube. And that tube is pressurized with 100% oxygen. And there are some physics laws that state if you breathe a gas under pressure, that can increase the concentration of the gas in the tissue itself. So if you're breathing oxygen right now, we're all breathing 21% oxygen. And your oxygen level, your saturation can get up to a certain point. If we were all given an oxygen mask and breathing 100% oxygen where we're sitting at normal atmospheric pressure, there's still a limitation to how high that oxygen could go. But if you breathe that same 100% oxygen in a pressurized environment like a hyperbaric chamber, you can increase the concentration of oxygen directly to the tissue. So the higher the pressure, the higher the concentration of oxygen. That's what hyperbarics is in general.
Okay, now let's switch it over to how Aviv is different, because this is what I found very interesting. I came to you guys not knowing too much, and knowing hyperbaric oxygen therapy was useful, but I'd known it in the classical mono chamber as you just discussed it. So tell me about how this HBOT is different from what you just talked about in the mono chambers.
Absolutely. So what we use here at Aviv, and you might see in some big institutions like hospitals, we use what we call a multi-place chamber. And basically, Dave's background is showing it, but for our listeners, if you walked into an airline fuselage, picture that, and airplanes are pressurized when they're taking off and up in the air. But picture that, and in this case, we're pressurizing to a level of, let's say, 2.0 atmospheres of pressure. And that's how you measure the levels of pressure. That's equivalent to diving 33 feet under sea level. So this picture sitting on an airplane, closing the doors, building the pressure up, and you're given an oxygen mask instead of just breathing 100% oxygen around you all the time like a monoplace chamber. The key to this is the ability to fluctuate oxygen levels. And this is what Dr. Efrati discovered and developed over the last 15 years. It turns out that the body responds to changes in oxygen levels. The standard, when the oxygen mask is on, it's just like the monochamber. You're getting high concentrations of oxygen to the tissue that needs it. But if you just take that mask off, inside this multi-place chamber, the ambient air inside the chamber is 21% oxygen, just like we're breathing now. So when the mask is on, your oxygen level is 17 times higher. When the mask is off, it goes back to normal, which is safe. But the body perceives that normal oxygen level as a low oxygen state relative to having that high oxygen. And when the body senses or thinks it's in a low oxygen state, it's anticipating cell death. This body is very smart. If I don't have oxygen, my cells are going to die. So I should probably replace them. And the best way to replace dead cells is make new stem cells. Stem cells are blank cells that can become any cell we want it to be. So the body will make new stem cells in this response. It'll also try to build new blood vessels, something called angiogenesis, to bring as much blood to the organs that might be starved of oxygen. So this concept is relatively new. There's something called the hyperoxic-hypoxic paradox. And the Nobel Prize was issued a few years ago for the discovery of a molecule called hypoxia-induced factor, or HIF, or HIF, as we call it here. That molecule is what gets released when the body senses a low oxygen state, triggering this cascade of healing properties. Now, I can't put you in a low oxygen state because then you're actually going to have cell death. But this discovery led to saying, hey, the body's just responding to relative hypoxia. So we just put the mask on, giving you 100% oxygen in a pressurized environment for 20 minutes, and then we'll just take the mask off for 5 minutes. Your oxygen goes to normal, it's safe, but the body now thinks it's in a low oxygen state. And we just do this protocol back and forth, fluctuating your oxygen levels. You get the benefit of high oxygen when the mask is on, but when it's off, you're triggering that cascade of healing properties.
So in a way, you're sort of working with the body to put it in a state of somewhat of a stressor, and it reacts to that stressor and then induces. Same thing you could see with cryotherapy and other types of therapies that induce autophagy and all sorts of things. And that's in direct opposition of what monochamber is, correct?
Yeah, monochamber, essentially you're breathing at 100% oxygen all the time because you're just put in the chamber. The chamber itself is pressurized with oxygen, so you're always in that high oxygen state. Now, for people with diabetic foot wounds, they're not getting enough oxygen to the distal tissue, and that's why we want to put them in there and help get oxygen to the cells to prevent them from dying. But you're really unable to fluctuate those oxygen levels the same way you can in a multi-place chamber.